Just as context, of course, the health service is now one of the biggest taxpayer-funded services that the government provides, and predictions suggest that in years to come, as people get older and sicker, we're probably going to end up spending almost a majority of public funding on health and social care. So this is a huge area to play with, and as I will explain to you, there are lots of problems with the health service, as well as it being a national religion that everybody loves and supports, and I'm one of those people. It also has huge numbers of difficulties, and I believe it's important for people like us and myself to expose that and to talk about those things and to nudge the system to a better place. So I do feel free to ask questions. I'm happy to answer some of those at the end, but let's try and just kick off. So just to introduce you to me, obviously that's me in my office. That's exactly what it's like, I assure you. I've got a bottle of whiskey in the drawer, a cigar are always available, or of course it's, as we know, it's not really a stereotype these days. But so I started work as a local journalist 18 years ago now. I really feel old saying that. And I'm an accidental health journalist. I never wanted to really go into health journalism, and in fact, I remember telling a colleague of mine, why would I want to go into health when you can do politics and crime and all of those really juicy things? And then I became a health journalist and realised actually there's a lot of politics, there's a lot of crime, and there's a lot of juicy things in health. And so I'm now a convert, as you'll see, and I've been reporting on health for almost a decade. And the reason why I'm accidental is because while I was working for the Express and Star newspaper in the West Midlands, I was working at a small town called Stafford. And I answered the phone one day to a lady complaining about the care of her mother who'd recently died in the local hospital. And I did a very small passport story, not very big, wasn't given much prominence. And eventually, if you fast forward from that story 4 or 5 years, there was a public inquiry into what became known as the Mid-Staffs disaster. This is the poor standard of care at the Mid-Staffordshire General Hospital. Hundreds of patients were neglected. It was an appalling story, one of the worst care disasters in the NHS, and it very much changed my life and my professional career, and is why I'm standing here in front of you today. So that's the bit of background about me, and the work that I do at the Health Service Journal is focused entirely on patient safety. That's my sort of specialist patch. But as you'll see, the HSJ does a lot more than just patient safety. So the HSJ, as I said, is on paper is a business-to-business news provider. We are independent of the NHS. We're not funded by the NHS. We're an independent news organisation. And we are online only now, and we're paywalled. And our readers are those who work in the NHS predominantly, chief executives, doctors, clinical directors, those kinds of people. Not necessarily the audience that you would think would be interested in exposing things and writing about things that go wrong, but one of my enduring fascinations with people who work in the health service is that they love to read about the things that are going wrong in the health service, as long as it's not their hospital. And they absolutely love a bit of Schadenfreude, I think. So the HSJ actually marks its 126th year in 2019, which I'm always surprised about, and it began as the Poor Law Officers Journal for workhouses in the UK. So it's got a long history of writing about health service. We're subscription based, 18,000 subscribers who are largely leaders in the health service. So these are not normally your nurses on the wards, although we do have some of those. It's predominantly those who lead the system. Often the Secretary of State and others like that, civil servants and fairly influential people read the HSJ, which is wonderful for us when we publish good stories. And because of that, we do have respect, and we are respected both by our readers and the health service, but we're also respected by other journalist outlets and national newspapers, and a lot of NHS stories that you see in national newspapers have their genesis with the Health Service Journal. And of course, the national newspapers love to take a story in the HSJ which hasn't really penetrated to the public's attention and dress it up as their own. Although, to be fair, most of them always do credit the HSJ somewhere in paragraph 35. Which we're always very grateful for. So the HSJ newsroom is quite a big newsroom actually for a B2B online provider. So we've got about 14 dedicated news journalists, full-time, that's their job. We don't do anything else, we don't do editorials, we don't do anything like that. We dedicated in writing about the health service and pursuing the news. We split the newsroom up into sort of reporters who have specialist patches, and the editor's done a fantastic job of bringing together quite a different group of journalists. So you've got people like me who love to go off and meet people in car parks and get leaks and do all the sort of, Watergate style investigations. I love that sort of stuff. And then we've got colleagues of mine who absolutely love trawling through data, spreadsheets, calculations, which is stuff that I absolutely hate. And so he's put together this team which is really good, and they all develop different specialties. So I do patient safety, other colleagues do finance, procurement, mental health, and we all zero in on those specialties, which gives us a real expertise and allows us to speak with authority about the health service. Our focus is off diary, so we tend to delete press releases, we tend to not really do diary stuff, not really do landmark speeches unless we can develop that, and the editor talks about added value, which I think is important. So what we write about is only if we can add something special. And again, because of that, we take our time, we do slower, more in-depth reporting, and that allows us to really have a bit of fun and also get to the real truth of the matter. And hopefully some of the examples of stories I'll talk you through, you can see the benefit maybe of just taking a step back, taking a bit of time, thinking about the work that you do rather than just bashing it out. I'm not a fan of journalism, and neither is anybody else at the HSJ, and we've moved very much away from trying to cover the daily news, because that actually gets in the way of the real journalism, in my view anyway. So we're independent, we have a very strong ethical newsroom, we do not do people over, we do not lie, we are very ethical, and because of that, the HSJ is trusted, which is why I believe we get so many leaks from the NHS. We get so many sources willing to talk to us. They know that we'll protect them, and they know that we're not out to get a cheap headline or to NHS bash. If I write a story saying the NHS has got something wrong, I believe our readers read it because they believe, well, if Shaun says it's wrong, then it must be wrong, and it's important that we know what that is. So we are trusted by our readers, and that gives us a real sense of responsibility as well to the work that we do, and we do take that very seriously. So I represent patient safety for the HSJ. I do write a lot about that, and I thought I never do a talk without just expressing sometimes the actual scale of this, and people often don't really realise what harm in healthcare actually looks like. So I'm talking here about avoidable harm. So obviously people get harmed all the time for their illness, and people sometimes have to be harmed to be made better, but there is avoidable harm in healthcare, and it's quite staggering, the scale of the problem. So across the world, the OECD recognises this as one of the global leading causes of the global disease burden. And 15% of hospital expenditure in OECD countries goes on actually mitigating the effects of mistakes in healthcare. And if you can imagine what that is, we're talking billions and billions spent of public funding trying to fix this problem. So we have over 2 million incidents a year reported to the NRLS, which is the National Reporting and Learning System, effectively a data repository of incidents reported by nurses and doctors. The data for this is open. You can look at the numbers of incidents and sometimes the categories of incidents, although it's not really very good, and you can't get down to the granular detail of nurse X gave patient Y a massive overdose. So unfortunately, they don't quite make that public. But it is that gives you a sense of how many incidents we're talking, and of course these are reported incidents by nurses and doctors. The vast majority are not reported, so you could probably double, triple, even quadruple that number, maybe a bit more. Unsafe care costs the NHS about £1 billion, maybe a bit more. Just think about what that means. How many nurses could we employ for £1 billion? How many doctors could we train for £1 billion? It's a staggering cost of mistakes in healthcare. This isn't easy stuff, and it isn't a case of just saying to doctors, stop killing people, nurses, stop making mistakes. It's just not that easy, but this just gives you a sense of how big the problem is. And out of those 2 million incidents, most of them are no harm or near misses. But we have in this country 24,000 severe incidents a year and 10,000 severe harm and death cases. That's I think is awful. You think how many families are affected by that. And so these are statistics. Statistics work. They show a picture, but sometimes you just need to have some kind of visual image of what this might look like. So I always like to show this slide. I did this once at a Royal College of Physicians talk. It went down really well. So this is the scale of the harm in healthcare. Every single week, a jumbo jet of mothers, brothers, sisters, children are crashing every single week, avoidably. These are all avoidable harms, about 150, 190 avoidable deaths every single week. So this isn't real, it's a CGI image, but it just kind of gives you a sense of the scale of the problem. So that's why I write about patient safety. And so you're here to investigate the NHS, so there it is, in its full glory. That's the NHS system that you need to get into. And obviously you all can understand that and see how the money flows, where the politics lies, all the decisions, or of course, it isn't that. I mean, look at it. It's what a mess, right? It's a dog's breakfast. And that's what we're dealing with as journalists. We have to find our way through this. This is a bit of a more simplified version, a little bit more understandable, I think. But even this is now out of date because NHS England and NHS Improvement are now merging without any legislative underpinning. So there are all sorts of questions around whether this is going to actually remain the case, and the government needs to change the law. But that's the best system I was able to find as an example of the NHS. And you can see sort of how the money flows and where the responsibility lies. And actually, when you think hospitals that deliver the care, they sit in this box here. And you've got all this other stuff flying around. It's a very vastly complicated system. And the only way to really investigate this is to, unfortunately, is to learn about it. You have to really become a bit of a knowledgeable person about the NHS. If you want to investigate the NHS, you need to know what this system is, who sits where, and how the money flows around, and more importantly, how the politics affects this system, who is the leader in this system. You need to read, learn, and listen. And one of the greatest examples I can give you of the benefit of taking some time to read and learn about stuff is this story, which is from the Express and Star. And it's a story that came from the public inquiry I mentioned into the mid-staff's inquiry. And the reason why I bring this up is because this was probably one of our best front pages from the inquiry. So the background to this is that we knew there had been some reports into the surgery department at mid-staffs, but the trust wouldn't release it. It wouldn't provide it. We couldn't get hold of it. It was not available through FOI. We tried. So we knew this existed, but we couldn't get it. Now, before the public inquiry started, I took one of the best decisions I think I ever did was download the Public Inquiries Act, and I sat and read it one night before the inquiry started. Actually wasn't a big piece of legislation, but within the Public Inquiries Act, there is this wonderful bit about the power that journalists have in an inquiry, and actually our ability to get hold of documents that the inquiry itself has and introduces into evidence. And in fact, as a result of this story, I was invited onto the BBC to talk about this for the Grenfell inquiry on the Grenfell podcast with Eddie Mair, to talk about the fact that this power exists, but journalists don't necessarily use it when you think how many public inquiries there are. But what happened with this was that a witness was talking to Sir Robert Francis, the chairman of the inquiry, and it was mentioned that the reports into the surgery department had been submitted to the inquiry. So I immediately recognised what I could do, and I ran over like an excited child to the inquiry press officer and said, under section whatever, clause B, etc., I demand to see these reports. And she said, you're not getting those, you can't get them. And I said, I'm sorry, here's the act. And I made her read it, and she scurried off. And about an hour or two later, Robert Francis passed me in the corridor and smiled at me, and I got hold of these copies, which that night we published this story, which revealed that the surgery department at Mid-Staffs Hospital was so bad that the Royal College of Surgeons had said it was frankly dangerous and inadequate, and at times was so lethal to the patients that something needed to be done. And in fact, a report had recommended that psychologists be brought in to work with the surgeons because they were deemed to be so risky to the patients, which we would never have known had I not taken the time to read that report. So that's just me just saying sometimes it's worth just stepping back and educating yourself a little bit about this. Obviously, you need to read and listen, but then seek out the experts. That's kind of obvious, right? I'm not a clinician, I'm not a doctor. The only way you're going to get to these things is to actually speak to people and get both sides of the issue. That's standard journalistic practice, right? But you'd be surprised how often doing that reveals some real insights and tips for stories. So I just put some photographs up here. These are all patients that I've helped, or families rather, of these patients that I've helped. It's something I hold very dear, having been involved in the mid-staff scandal. I believe patients and harmed families have an incredible struggle to get the answers, and it's up to us as journalists, I think. It's a public duty on us to try and help get those answers, especially when they raise systemic questions. So very briefly, in each one of these cases, Lizzie Dixon died in 2001, and in fact I didn't pick up the story until 2014, so imagine how that was for her parents, trying to find answers for that long. And I only got involved because NHS England cancelled an inquiry into her case, and we picked that up because effectively nobody was then going to investigate the case. And actually what we were able to uncover by writing about this was a regulatory gap. No national body was able to help this family and investigate them. So I wrote about this, and I wrote about there was proven clinical negligence in the case of Elizabeth, but the system wasn't able to address the issue, wasn't able to investigate and provide the family with answers, or to assure the system that it had learned, or assure taxpayers rather, that it had learned from the error. So when we wrote about this, multiple national bodies said, well, we can't touch it, we can't touch it. And in the end, the Secretary of State, Jeremy Hunt, reading the Health Service Journal, appointed an inquiry to consider this. And in fact, the inquiry is still going on, and fingers crossed, I hope it comes to a conclusion this year. But that inquiry wouldn't have happened without us picking that story up. And it'd be very easy as a journalist, I think, to dismiss a person who rings you up and says, my baby died 13 years ago, will you do a story about it? And in fact, I remain very proud of the fact that the HSJ picked that up and got this family an inquiry. Next to her is Johnny Meek, who's a young boy who died at Stafford Hospital in 2014. He was disabled and was receiving feeding treatment and had an allergic reaction and died very suddenly in the hospital. And believe it or not, as part of our investigations into this, the family obtained some records that showed that the evidence from the trust to the Child Death Overview panel that considered Johnny's case was that he just suddenly died. And in fact, there was a statement, or a suggestion of a statement from a healthcare assistant, that he just died suddenly in his mother's arms. Well, we spoke to that healthcare assistant, who went on record with the Health Service Journal saying that she'd never made that statement, and that in fact she didn't subscribe to that view, which was staggering really, that Stafford Hospital, after everything that it had been through, was allowing things like this to persist. So we wrote about that, and an independent review was taken place, and actually the experts came back and said the hospital was wrong. Johnny didn't just suddenly die, he had an allergic reaction, and now the family have just been given permission, just in the last few months, that the original inquest verdict is going to be quashed and a new inquest held, and so that, you know, great result for them. But in each of these cases, there is a systemic issue that they expose, and in this case, it was about the Child Death Overview panel and how evidence was shared and how the inquests were held. And again, I hope that the outcome of this is a change to the system. And at the bottom there is Ken Goodwood, who was a patient at Leeds Teaching Hospital in 2015, and he was actually beaten to death by another patient in the hospital with a walking stick. Another patient who also died was Roger Lamb, who was attacked by the same patient. He was trying to help Ken, and he was knocked to the floor by this patient who was actually paranoid schizophrenic, who hadn't been given his medication, and his daughter had said to the staff, he will relapse, he will have a violent reaction, and you need to, you know, medicate him, and they didn't, and unfortunately that resulted in the deaths of 2 patients on a hospital ward. Now the reason I've got this here, and the reason I wanted to mention this, is because this story, this murder on a hospital ward, murder, I mean there were 3 victims in the story, I should say. The patient who needed his medication, all the families agree that he was a victim too, but he died shortly after from cancer, so was never sort of prosecuted by the police or anything like that. But this happened on a hospital ward, and the story never made the Yorkshire Post or any of the papers in Leeds. And in fact, for 3 years, not a word was said about this. And I got contacted by a whistleblower who said that the families were being treated appallingly in the search for answers. And I thought, there's no way this can be true. There's no way 2 patients were attacked on a ward and killed and nothing was reported about this. It turns out this was true. I don't know how this didn't make the papers, how nobody told the local papers. It's a sort of comment on local journalism and its penetration, maybe, I don't know. But for an online small publication like the HSJ to be picking these things up rather than large local local newspapers, I think it just says something. But we were able to expose the fact that there'd been a report written about this case which said that, in fact, on the ward that Ken was on, there were dozens of violent incidents, that the staff weren't being trained in how to look after things. And in fact, patients with mental issues were being dumped on this ward. And the cases of violence on this ward were shocking. Patients being threatened, chairs being thrown, cutlery, stabbings, all sorts of violent things. I just can't imagine the environment that the staff and the other patients were working in. But what this exposed was the difficulty of mental health patients in an acute setting, and how their needs weren't necessarily being met. And now patient-on-patient attacks is actually a real issue that the NHS is beginning to look at, and something that I'm really pleased that we highlighted. So that just gives you a flavour of some of the work that I've done in the past. Now, in terms of going further and deeper, these are 2 headlines that I did back in 2016, and this was a great result for journalists. We ended up getting the Parliamentary Health Service Ombudsman had to resign over the things that we wrote about, and so did her deputy, because it turned out her deputy had been involved in covering up a sexual harassment case at his NHS trust before he got this job. And the reason I mention this in the going further and deeper, so the employment tribunal that revealed this was available in the public, and the Care Quality Commission did an inspection of the hospital that was involved and mentioned the employment tribunal. And all the national newspapers wrote about the CQC report and they wrote about the tribunal, but none of them made the connection that we made. And that was because I took the time after the CQC report to go and find the employment tribunal, and I read it, and I realised that the name Mick Martin was actually the deputy ombudsman now at the Parliamentary Health Service Ombudsman. And how could he hold that role when he'd been found by effectively a court, which is what an employment tribunal is, that he'd been involved in a cover-up? The ombudsman is supposed to be overseeing that sort of thing. So we pointed this out. And it turns out that the question then became, well, how was he appointed to this role? Because this happened before. And it turns out that the actual ombudsman, Dame Julie Mellor, had been warned in a letter. Warned twice in a different letter, and she'd allowed this appointment to go forward. So when we exposed this resulted in an independent inquiry, and it resulted in her resignation and a new ombudsman and a change to the culture in the ombudsman. We had a story about whistleblowers from the ombudsman coming forward about the culture underneath Dame Julie Mellor and how she was running the service. And so we managed to get that all changed. And again, just another example of, I know it's hard when you're faced with deadlines and things like that, but if I hadn't just said, the CQC is mentioning this employment tribunal, I should read what that employment tribunal said. And if I wasn't aware of who was in the system and who was in those positions, going back to the map of the organisations earlier, I would never have been able to connect the dots and get this story. So just again, another example of why it's important just to take your time. Sorry, I have to keep running over here to do this. But so this is another example of stories that we did, and this is a slightly different example around a story that we got in the junior doctors strike, which, if those of you remember that, a hugely controversial issue. And the reason we got this story, which was about the huge leak of WhatsApp messages between the junior doctors committee, so a very closed group, and what they were talking about and what they were saying in private and what they were saying in public was very different. And when we exposed this, it pretty much did for the junior doctor's argument. Now, I'm not going to get into who was right and wrong about the contract, but from a journalist perspective, this story, the WhatsApp leak, came about because of these other stories that we did about the dispute. And in fact, what I did was earn the trust of a whistleblower who said to me, if you do this and do it well, I'll give you something, but I need to know that you'll do it right. And so we did several stories. And in the end, we got the WhatsApp leak, and it was a fantastic story, made national news all over the place. I was on Sky News, etc., and it was just about earning the trust of the whistleblower not just taking the easy story and actually working with them, listening to them and earning their trust, which, it's got to be the day job, right, for us. We've got to earn people's trust and protect them as well. They needed to know that they were protected. And in fact, an amusing side note to this, the BMA spent, I believe, about £250,000 on an inquiry trying to identify the source of our story. And unfortunately, they identified 2 doctors who I think had fallen out with other members of the committee, and they were effectively kicked out of the BMA and accused of leaking this story. They were not our sources. So it's kind of sad for them, but I think it's also a bit of an interesting thing that the BMA tried to do that. Openness and transparency in the doctors' union. But it's a story that I think people still talk to me about. But I also just have to show, I really loved what the Huffington Post did with the story. Great headline, right? It's a professional highlight for me. I wish I'd thought of that headline when we wrote the original story. So a quick couple of stories that I've done and talk about the investigations that I've done for the HSJ. So one investigation I did was into maternity deaths in the NHS, and this investigation began by, as I said there, a trigger event which was basically a coroner's report. And I'll mention coroner's reports a little later. For those of you who may not be aware, coroner's reports are published by the Ministry of Justice on .gov.uk. They are a fascinating resource. They're open to everybody, so you can't rely on them for an exclusive story, but they do give you some real interesting insights into when things go wrong. And what these are effectively a coroner's reporting to the system their fears of future deaths. And one such report was about maternity cases, and in particular it mentioned the issue of heart monitoring. And what we were able to do is take that one coroner's report and we then looked to a bigger issue. So I spoke to universities about the training of midwives in using heart monitors. And these were off-the-record chats. I was just looking to be briefed effectively on the issue. And what we found was that, in fact, this was nothing new. What the coroner had said had been said by several other coroners going back over time, and we were able to pull all of those out. And we contacted some of the families involved, and I'll talk a little bit later about contacting families after a coroner's report. But what we were able to put together was a data story. We looked at the litigation costs of where midwives had failed to respond to abnormal heart rates. And what we found there was the litigation authority had written a report 10 years ago warning about this issue. So you just started to see, we built this whole picture which began with just one coroner's report. And the end point of that is we could have had a really negative story. The NHS is killing loads of babies, which it is, and it's not doing enough about it, and it's not learning from it, and that's all true. But we didn't just stop there. What I then did is we went and found a hospital which had had this problem with heart monitoring and had turned it around. The trust that we spoke to had turned this around and gone from 75% of their errors involving heart monitoring to having 0 after making some changes to culture, employing human factors specialists, etc. And what we did is we included that as a sort of case study at the end of the story, as a sort of solutions sort of offer to the readers. And in fact, that was really, really popular. So this investigation was about 1,500 words long, and people really bought into the narrative of a problem and exploring that problem, understanding the issues, and then the possible solutions, especially for our readers who are delivering these services. It worked really well for them. And so it's a potential model for how to craft an investigation which works for a healthcare audience, and it can work for anybody, I think, because these days, journalists, we get told off and we get labelled with just looking after the negative stories. And in fact, a good side of an investigation can be to say not only how it's bad, but also here's a place that's really good and everyone else can learn from. And I think that's just as much a part of a journalist's job as to tell those stories as well as the negative. So that was an interesting investigation to do. So a couple more investigations that have made the front pages of national newspapers. So on the left there is the maternity death scandal at Shrewsbury and Telford Hospital. Now, I share this story with the BBC and Michael Buchanan, who's done some excellent work on the scandal at Shrewsbury and Telford hospitals, but this particular story was mine, so I'll claim this one. So we knew that there was an inquiry going on into cases at Shrewsbury and Telford, and I'd written about the hospital and about one case back in 2014. And what we found was the government inquiry was going on into 23 cases. But by talking to people in the trust, earning their confidence, talking to families, I managed to find out that there were actually several other investigations going on into incidents in the maternity department which were not part of the government review. And we found out that the Royal College of Obs and Gynae had been called in to do a review, that there'd been a maternal death of a mother in December 2017, which hadn't been shared with the government review, and that the trust itself had identified dozens of other cases. And so what this started to look like was a hodgepodge of investigations. And actually, we're in that situation, how can we be sure that we're going to get learning? So we wrote a story about this, and the families called for the inquiry to be widened to look at other cases. And so our headline on that story was dozens of extra cases. We shared the story with the Daily Mail, who did an excellent front page on it, and Matt Hancock, the Health Secretary, widened the review to say it should look at any cases. Well, I can tell you now, far from dozens, the cases being looked at now number well in excess of 320. A huge number. We don't yet know what the outcome of this will be, but one source with us told us that this could dwarf the Morecambe Bay investigation into babies' deaths, which was a major scandal a few years ago. And the families, who are extremely brave, and they do all the hard work on this, they really do, but we give them a bit of a voice. And they've said, without our coverage and the Daily Mail's coverage, we would never have got to a situation where hundreds of families are now getting the potential answers to their questions. And that story all came about by just linking together different things and posing the question of, is this good? Is this the right way forward? And you can see the result. And on the right here is another story, which actually is a sort of 4-byline story with my colleagues. Bit of a great story, and this one is how we got it, a combination of different ways of finding stories. So a colleague of mine who looks into procurement and contracts, and he was aware that a company was going to go bust and had contracts with the NHS Trust, waste contract. And he said, well, this is a little interesting story, nothing massive. At the same time, completely independently, a source of mine said, we need to meet. I need to give you something. And he was very mysterious about what this was. So off I popped to meet him. Very, very, I'm going to say this, I know it's very Watergate style, And he said, you'll never meet me again, but you need to have this. So I met him on the street, and he just handed me this document, and he said, that's it, and I'm out, but you need to see this. And he walked away. And I'm on the train back to the office, and I get an email from my colleague who says, I'm working on this story about a waste contract. And I'm reading this document that has official secret on the top from Cobra, and it's talking about the same contract. But what he didn't know, and what this document revealed, that there was 20-odd thousand tons of body parts just mounting up around the country because this company wasn't collecting the waste. And there was a huge scandal brewing with trusts being told to store body parts. And we're talking severed limbs, stillborn babies, all sorts of awful things, organs, etc. And those are just being kept in hospital car parks and bins. Awful story. And putting those two things together, and I remember I sent my colleague an email saying, hang on, I've got this, and this is what this says. 21,000 tons of body parts being piled up around the NHS. And he just replied to me saying, that changes my top line, which I thought was really funny. And we still talk about that now, but that's been entered into awards, and both of these are sort of award-winning stories that we've done. And another example of sort of HSJ's impact. Small publication, but because of our expertise, because of our good sources, we get these kinds of stories. So this was a story we did recently on the Healthcare Safety Investigation Branch, which is a new organisation designed to investigate safety incidents in the NHS, a bit like the Air Traffic Investigation Branch. And we'd given this organisation loads of good coverage, and we were sort of positive about it. I think it could be a good idea. We've never had this kind of independent investigation service for the NHS. But then what we started to get was staff telling us about problems. And this story involved about 7 different whistleblowers coming to us. And this is where, talking about whistleblowing and how to help people, these people were terrified. And they are generally in the NHS. The culture in the NHS is pretty appalling. And you'll see many cases of whistleblowers who are hung out to dry by the service. So, I am knowledgeable about the Public Interest Disclosure Act and how people can use that. I actually don't think that's really very helpful for whistleblowers, because the only time that really helps them is when they already find themselves in court and they're either suing or being sued by the organisation. You don't really want to get to that stage as a whistleblower. So I worked with lots of people in this story about how they could share their information with me in a way that we would protect them. talking about how we would display it, how we might misdirect where some of the sources came from, some of the information came from, and that's an ethical question. You know, you don't want to do it too far because you're misleading the reader, but at the same time, you don't want to say, you know, the chief executive secretary said, you can't do that either. So that wasn't the case in this, by the way. But this was putting together multiple sources, and the strength of that testimony, once you've said to the people, okay, well, this is how we'll protect you. And I said to them all, I can talk to you off the record first, and I gave them an agreement. Nothing will be published until you're happy with what we're doing. And so we had a conversation, and I think sometimes I see journalists make mistakes by immediately just slipping into interview mode and immediately trying to suck out the information from people. And I genuinely think sometimes the best way is to actually develop a relationship with these people. They understand where they're coming from, they're frightened, they feel they're acting in the public interest, they genuinely contact you for the right reasons, but they need some reassurance. They need, in effect, for us to hold their hand. And that's our responsibility as journalists. So that's what I did in this case. And we put together an excellent story. And the chief executive of HSIB actually submitted himself to an hour-and-a-half grilling by me in the office, confronted with a dossier of terrible things from his organisation. And he took it on the chin and actually acknowledged that they'd made some mistakes and that they were pledging to make some improvements, which was a good win for us, but that was ultimately what the whistleblowers wanted. And it was ultimately good for the patients who this organisation will hopefully deliver some questions for as well, so some answers for. So that's just an example of working with whistleblowers, which we do quite a lot. And so this is a story. Now, I'd urge you all to find this one. Now, if anybody wants it, I am available on Twitter, and you can find me, and I'll share this link with you, because the editor actually made this story open to read in the public interest. So HSJ is paywalled normally. This also got picked up by all the national newspapers, but it was a story we did just a few weeks ago, actually. It was a result of about 2 years' worth of effort by my part. I probably could have done it a bit quicker, to be honest. But this was a real good story. And what this was about was really a cover-up at the very highest levels of the NHS. So this is about cancer services in London and the Royal Marsden Foundation Trust, which is a specialist cancer service and has a paediatric cancer service, but doesn't have an intensive care unit. And what happens is that children who are receiving their cancer treatment who deteriorate get shipped off to another hospital 8 miles away in the back of an ambulance. And what we were told was that this involved hundreds of transfers over the last decade with several patients' deaths and poor treatment. Now, the chief executive of the Royal Marsden also happens to have been appointed the National Cancer Director for the NHS. And for some reason, the NHS wants to cover up reports about concerns about the Royal Marsden's cancer service. Isn't that, what a coincidence? So we looked into this, and this began with just a single sentence email. All it said was, are you aware of a report into child cancer services? And I wasn't, and we started to look into this. And I've just said here how this started was, first of all, I began with Google. I was just having a look around this and found a couple of sort of hints to a report that existed. And in fact, there'd been a report in The Guardian about this big 2015 report that had been commissioned into it, which had never been published. And so I started to find out about this report, who wrote it, who was involved in it, and I ultimately found the author of the report, who we were able to convince to go on the record. Families contacted us, they were able to piece all this together, bring it in. This is how an investigation comes together. And the Mark Lee Hunter I know is talking tomorrow. I'd urge you all to go to his session. Oh, I think he might not be, but oh, that's a shame. But he's sick. But there is a story-based inquiry, which I think is something he's written. You can find on the internet. Sets out how you can do this level of investigation. And I used his sort of principles for this and built this up over many, many months. But the outcome was great. So we published this. But the key to any great investigation, and this is my sort of one message to you, is the follow-ups are key. Okay, so the follow-ups really are key, and this is how we did it. So as one story that went out on the investigation, this chap, Andy Mitchell, was the director for London for the NHS. Now, for someone like him to go on the record is quite incredible. He'd retired, so he'd got less risk, but even then, you still don't get people to go on the record like this. And he went on the record with a full interview accusing NHS England Chief Executive Simon Stevens of a cover-up, which was incredible. And he described a pervasive influence at the top of the NHS that blocked the publication of this report. But not only one report, we found out there were several ones going all the way back to 2010 about the concerns at the Royal Marsden in London and saying that it should be changed. And here we are in 2019, the model is largely unchanged. But this isn't all historic, okay? So we looked into what was happening right now, and of course, after the story broke, NHS England said Kelly Palmer, the National Cancer Director, would play no part in decisions about child cancer services, which were being changed and re-examined at the moment by experts. Okay, sounds good. But then we learn other things. So these are all follow-ups that came after the story. So the first follow-up was a suggestion that clinicians looking at child cancer standards had been put under pressure to change them. And we used each story to open up doors for the next story. And we thought about this before we published it. And that's the thing, and that's really why I'm showing you all these follow-ups. Think about where your story goes after the first story, because it can be very tempting to just, I've got to get that story done, I've got to get that one out. And then the story goes out and you get a big sort of day of interest. But then if you don't build on that, you'll lose it. And so this was a suggestion of pressure on clinicians, but not from any of the clinicians involved. So naturally, we then go and try and find the clinicians involved. And what's fascinating about this is that people were prepared to talk to us. Such concern there was out there that we were able to get this. So the next story was a clinician who actually went on the record. He was in the room on the day that they were all told, your recommendation about intensive care services must be on the same side. That's got to change. And that advice came from the National Cancer Team. Who heads the National Cancer Team? The Chief Executive of the Royal Marsden, which is the only trust in England which doesn't have an intensive care unit on site. This is all coincidence, obviously. But him going on the record, he was in the room. And so that was a hugely powerful story. That was effectively NHS England, non-clinical managers, interfering in the clinical standards and evidence and advice to the NHS from clinicians who clearly know far more about it. So that was a really powerful step. And so the next story results in this. And actually, to be fair to NHS England, they actually gave us the documents that allowed us to run this story, but only because in a previous story which you mentioned about Kelly Palmer not taking any part in this, she mentioned that she wasn't at the committee that made the decision not to publish the report. A fantastic clue to ask NHS England, well, who was on this committee? What committee? When did it meet? What was the decision? And so the only records NHS England could find was a record of a committee where NHS England Chief Executive Simon Stevens was present. So the suggestion is if the decision was made there, that he was there, so he was involved. And actually, as a result of this story, just last week, he faced questions at the Health Select Committee about our story and about this cover-up, and he was asked directly who made the decision. And he said 4 years on, we can't find the records to establish who did make the decision not to publish this report. Form your own conclusions as to what you think about this. But the outcome, of course, is that you've got to have a win in any big story. And our win for this is that NHS has announced an inquiry led by Sir Mike Richards, who is a leading clinician in cancer, was a former cancer SAR for the NHS. And he's going to report on all of these issues and report publicly to the board of NHS England. So a great result for us, and we'll see what he comes out. But I think that's just an example of how follow-ups need to work, and you can build a kind of almost a campaign without thinking about it. But we followed the threads and pulled them, and we'll see where they end up. But I think that was a win for HSJ, and it was a win for children with cancer in London, assuming they get better care in the future. So very quickly, because I'm running out of time, I just wanted to have a little tiny rant at you all. So I mentioned coroner's reports earlier, and I wanted to just say it's really easy with coroner's reports because it's all there in black and white, and it's a public document to just write the story. Now I have a sort of personal policy that I follow because these coroner's reports usually always mention the name of the deceased, and these people usually always have families, and I usually go to great lengths to try and find these families. And the reasons for that is twofold. This isn't just to get a heartfelt, heartbreaking quote for a story, although obviously that does help to elevate the story. Families know a lot more about what happened. Coroners and inquests are not brilliant at giving out the full facts. They only have to answer certain questions, and a family can be aware of a lot more going on. So if you make use of these coroner's reports or any example where you come across a deceased person, try to find the family. And the reason I've put this up there is because I was tracking down a family, and I tracked them down using Companies House, using the name of the deceased and making connections. I found out that the deceased lady was a director of a company who also had a director with a similar name, and I contacted the company. It turned out that was her daughter, and I had to start earning her confidence. She was very wary about this. She was really concerned about the care her mother had. The coroner had raised concerns about staffing levels, nurse staffing levels in the hospital. And this was an issue I wanted to get in because vacancies and nurse staffing in the NHS is a big issue. So I was working with her. She was very nervous, and I held off publishing the story. Unfortunately, a local newspaper, a rather large local newspaper, got the coroner's report, made no attempt to contact the family, and published the story on its front page, taking very brief introductions from the coroner's report, slammed it on the front page. This massively upset the family. The person I was talking to effectively had a bit of a breakdown. She thought at one stage that I'd given it to the local paper. It broke all levels of trust with me and her. We haven't yet run a story. I'm hoping that maybe we can do. And I know, and the frustrating thing for me is I know there is more to it than what was in the coroner's report, a lot more. And the local newspaper doesn't know this. And if they had just tried to do the same thing as me, I'd have been quite happy for them to scoop me. But they just didn't bother. They just took the coroner's report and ran a story because it was quick, it was easy, it was cheap. But that's not good journalism. And if you want to investigate the NHS, you've got to speak to people, you've got to speak to families, you've got to go that extra mile to get the detailed story. So that's why I just want to have a little rant there to say, you know, that's the effect of journalism. I don't blame the journalist at a local newspaper. He probably had 15 stories to write in 2 hours, and that was what he had to do. But the effect of that on the family was really profound, and I think all of us should just bear that in mind when we're doing our job. In health, there are consequences to what we write about for people, both those who work in the NHS and those who are served by it. It does really have an impact, so just bear that in mind when reporting on health. This is sort of my attempt to kind of just express how I think why the HSJ and my team are successful. So the top of the triangle, we have contacts. So we spend a lot of time making contacts, really working that hard. Our journalists do get the time to go out and meet people, spend time visiting hospitals. They're not, when we say to them, okay, you're not under any pressure to file stories today. The contacts are key, right? I mean, this is journalism 101, but I just wanted to sort of emphasize that for the health service, you need to have good contacts so that you know what you're working, what people know that you're not just talking rubbish and you know what you're on about. And that is aligned with the knowledge. So if you have good knowledge and you've learned and you've taken the time to read about the NHS, know how it functions, where things are, who's in charge, what's going on, your contacts are suddenly going to realize they're talking to someone actually almost on the same level or same page as them. So the two start to feed each other, okay? And that's what we do at the HSJ. And we often have contacts come to us asking us questions because they think we'll know the answers, and sometimes we do. And it's interesting, I think the HSJ journalists know a lot more about the way the NHS system works than doctors or nurses. We don't know anything about caring for patients, of course, they're the experts in that regard. But in terms of how the system works, we know a lot more than them. And so that's how that works for us and our contacts. And of course, personal integrity. I think one of the reasons I do well at HSJ and the other journalists do, we are not out to do people over. We take it very seriously. We have a responsibility to tell the truth. And we're very fact-based, and we don't editorialize. You know, and I'm very well known for being a patient safety campaigner, but when it comes to my journalism, it's about facts, and people know that. And people who don't like what I write still talk to me. Because they know that I won't do them over, that I'll do the right job. And so I think that's just my sort of underlining, and I put an underline on that one because I really do think if you don't have that, then everything else will go away. And you need to show this and evidence this in your work and how you write and how you approach people. You know, give them that sense that you're someone they can do business with. It will pay dividends. If you ring up and you're so obviously out for a story to criticize a hospital, if you're so obviously out to criticize a doctor or a nurse, you're not going to get anywhere. What you need to start talking to people in the health system, you've got to start saying to people, this is about the system. We want to change the system. We want to make things better for patients, because that's what everybody wants. Whether you're a manager of the NHS, a harmed patient, or a hard-pressed doctor or nurse, they all want that. And so if you're as a journalist, if you align yourself to that position, quite rightly, I mean, that's what you want anyway, that you'll get somewhere. So I think that, you know, come across in how you work, how you approach people in the NHS. So I'm afraid that's me. You can send abuse there. And happy to help anyone. If you've ever got any investigations, do please let me know. I'm happy to help.